Hi, this video is for retreatment or repeat RCT. Now, repeat RCT is very difficult. I believe that a repeat root canal case is at least 3 to 4 times difficult than a normal routine case. I'll be making this video in two parts. In the first part, I'll try to show you what information can we get just looking at the IOPA, or what goes into my mind, a mind of an endodontist, when we see directly at the IOPA of the patient. The second part will include a description, a clinical demonstration of how to remove gattapacha. Now this will be the second part. So let us start with the first part. So when we look at the IOPA, when the patient comes to your clinic, you get the X-ray done. There are two things that you should look out for. The first thing that you should look is the restorative prognosis of the tooth. The second is an endodontic prognosis of the tooth. Now the restorative prognosis depends on how much of the tooth structure is left beneath the crown. So for that, you should always remove the crown first. That will be my first tip. Now, what is the information that we can get from looking at a X-ray? Now, first of all, when I look at the IOPA, I would like to see why did the root canal fail. Now, if you look at this X-ray, the root canal has not been very properly done. Let me show you the complete IOPA. So this is the complete X-ray of the tooth. When you look at this case, first thing you should notice in the crown structure is that the crown is leaking right beneath the crown area. This area is leaking. Okay, so we have a secondary caries beneath the tooth, and this is the main cause of influx of the bacteria into the tooth. Okay, a faulty root canal treatment or a bad root canal treatment would not fail unless it is leaking. Okay, so this is not a good root canal. There are multiple things I can see here. I'll tell you in a while. But the first thing that goes into my mind is that it is leaking from here. The second information that should come into your mind is how much has the dentist gone inside the tooth. Okay, so for that, just look at this gattapacha. It is extending till the middle third of this canal, and somehow the dentist has stopped just here and he has put some short GPs. Okay, so the dentist might or might not have gone till the full working length of the tooth. Now that dictates a lot of things. For example, if the dentist had gone till here, if the obturation was done around till here or 1 or 2 mm short, then I can make out that I have to remove the GP and I have to put the calcium hydroxide by achieving patency in the canals. Okay, so we must look that how much has the dentist, the previous dentist, has gone inside the tooth. Okay, the another information that you can get from this is, if the dentist has not gone till the full length, just look at this. The dentist tried to go till here and then he stopped. So what that means, it could also mean that this will complicate the treatment further. How? Because the dentist tried to go till full working length, but he tried to negotiate till here, and he could achieve the negotiation only till here. And maybe the dentist, by continuously trying to achieve patency, he made some errors here. For example, ledges, or he might have blocked the canal completely. So that also you can look into the X-ray, that how much the dentist, the previous dentist, has accomplished going inside the canal. The second or the third thing which you can see is there any broken instrument here? For example, let me show you another case here. Now look at this X-ray. If you look at this X-ray, in this tooth, there is a broken instrument right here. Okay, so this is another information that you can get, and this will further complicate the treatment for us. Next thing, what you can see is there are sometimes perforations inside the teeth, which I'll show you in some other X-rays. There are perforations when you start the treatment. So a good IOPA, a good quality IOPA is a must before starting any kind of root canal treatment. Okay, the another information that you can get is, has the dentist missed some canals? So in some cases you can see that there might be missed canals. For example, you can see there is one GP here, one GP here. So definitely the dentist has missed one canal in the mesial root of the tooth. Okay. Now, what is the target? What is our target when we try to accomplish a repeat root canal case? Our target as an endodontist or as a dentist, as a general dentist, our target is to reach till the full working length of the tooth. Our target is to reach the full working length of the tooth, achieve patency, achieve positive patency, and put good quality calcium hydroxide into the canal after thorough irrigation, good proper amount of intercanal medicament or intracanal medicament till the full working length. Try to put it till full working length and then properly seal the tooth for around 3 to 4 weeks. That should be our target. That is our target. Achieving a good patency till the full working length of the tooth. That is our main target. Now, how do we decide the prognosis of a tooth? For example, when I look at this tooth, if I can achieve the full working length with good patency and my calcium can flow till here, then I would say that my prognosis is more than 95% of success. Okay, then my success rate is more than 95%, I would say. Now, in some cases, what happens is, suppose there are 3 canals in this tooth. Suppose there are 2 mesials and 1 distal canal in this tooth. Now, for example, suppose in my distobuccal canal, I can achieve my full patency. In the distal canal, I can achieve my good patency till full working length. And suppose in my mesiolingual canal, I could not achieve good patency, or I could not go till the full working length. Then my prognosis of the tooth will definitely come a little down. Okay, what will happen is 1/3 of the prognosis is now gone. Why? Because there are 3 canals, I could achieve patency in 2. So I can disinfect 2 canals properly for sure, but 1 canal I cannot achieve good bacterial control. So that will reduce my prognosis of the tooth by 1/3. This is how I would explain the patient, but that can only be done after the first appointment. Okay, so when the patient asks you that, sir, what is the chances of survival of my tooth, so you have to tell them that, sir, I can only comment that after the first appointment. Okay, in the first appointment I'll try to achieve the patency. If I can, then your tooth has a good success rate. So this is how we plan a tooth. Let me show you another x-ray. Now this is a central incisor that has a large radiolucency beneath the tooth, and the dentist has tried to go to the full working length, but still there is a good amount of bacteria inside the canal. Okay, so what has happened here is that the dentist sometimes might go till almost the full working length, but there might be still apical pathology. Why would that happen is, while doing the disinfection or while doing the biomechanical preparations, some dentists, what they do is they keep the tooth open in between the appointments. Now, inter-appointment, if you keep the tooth open or open dressing, I would ensure you that there will be bacteria present inside the tooth. Now your tooth will fail or your endodontic therapy will pass, depends on the immune status of the patient. Whenever the immunity goes down, the bacteria will find a way to cause pathosis beneath the tooth. Okay, so this is why sometimes, even if the dentist can achieve almost full working length, you will find a good periapical pathology beneath the tooth. Now, if you look at this tooth, another thing you can see is there is a deep cavity in the adjacent tooth. So always ensure that when you take a pre-op x-ray, you should always ensure that the surrounding teeth also come into the picture, so that you know that the another tooth can also be painful. So what happens is you suddenly start treating the tooth and the patient finds that the pain has still not gone. Okay, so be very careful of the adjacent teeth, what is happening in the adjacent teeth. The another thing what I can find here is that you cannot see the full canal in the tooth. Okay, so this might have some blockages or it might be calcified, so be very careful of that. And this is the information that you can get just by looking at the IOPA. In the second part of the video, I'll try to demonstrate how we can remove gattaparcha and what are the things that you should follow while you are planning to remove the gattaparcha from inside the canals. Thank you.